Hello again. It's after work. It's about 3 o'clock in the afternoon, and I got out a little bit early today, which was nice. I was planning on giving away all my visits today so I could work on my PowerPoint presentation for the core course. But as it turned out, I still had 3 visits to do today, so I'm getting out a little bit early, which is nice. But I, originally intended, what I was hoping to do was just be able to spend my entire workday today working on the PowerPoint presentation, and that did not quite work out, so I'm going to be working on it this evening. Thankfully there's no homework due till tomorrow, but the homework that is due tomorrow is pretty considerable. I have to do a concept analysis paper for my nursing theory class, and there's a bunch of articles on reserve for the class that we can use as like a jumping off point. We have to pick one of the pre-approved topics, or if we want to do it on another topic, we just have to send them an email. So I'm going to do mine on lateral violence, which is a concept that I find not very many people have heard of before I mention it to them, but it basically means, what's a good way to put it, being catty or abusive towards your coworkers, not being very nice to your coworkers, that kind of thing. It's a pretty easy topic to research, and I am doing the entire paper in one night, so it should go by pretty fast. My caseload is up to like, I think 13, 14 people now. I'm really getting up there. I'm like checking in and looking at the whiteboard in the supervisor's office to see how I like stack up compared to some of the older nurses, and I'm right up there now. I have a caseload comparable to the hardened veterans that work with me. I've got 2 speaking engagements coming up soon. One of them is like sort of like a welcome and appreciation and congratulations reception for the volunteers at our agency. We just finished a new volunteer class, a bunch of people. I did manage to get a friend of mine to come take the volunteer class, he's going to be volunteering as a patient care volunteer, and he also is an accomplished violinist, which was a fact that they pointed out about him in the newsletter that they sent out to all of us, congratulating them all. And then the other one is the core course, the hospice core course. I posted a video of my presentation from last time that I did that, and then that's also the PowerPoint presentation that I really need to work on tonight. So the executive assistant can get all of the handouts printed out and stuff. And so you can watch that if you scroll back through my previous videos. You can see my presentation on pain and symptom management from 6 months ago. And one of the things I really wanted to do before this next, core course comes around was I really wanted to stop using PowerPoint and start using Prezi instead, Prezi, because it's vastly superior to PowerPoint in pretty much every way. But I just haven't had time to sit down and learn how to use it. It's like really easy to use, and the company that makes it will give you help if you need help learning how to use it. But between working full-time and school full-time, I really haven't had any time to just sit down and put together a presentation in a new software. Not to say that I don't have the time to do it, but the time that I do have to do it, I spend doing other things like resting, taking care of myself, hanging out with friends, things like that, which is absolutely vital to continue doing no matter how busy I am. Hence the waiting until the last minute to do my school assignments and things like that, which still seems to be working out all right, by the way. A's, A-minuses in every class. They warned me that this accelerated online degree program would take like 15, 20 hours a week, but in reality it's more like 2 or 3 hours a week, so still leaves me plenty of time for hanging out with friends and playing video games and stuff. What else is going on? I'm seeing more more social media stuff come out of my employer lately, which is kind of cool. That I've friended some of my coworkers on Facebook, which I was very hesitant to do while I worked at the nursing home, seeing as they already threatened to sue me about, posting blog entries, anonymous blog entries about work. But everybody's a lot more laid back at this place. And actually, the first person that I friended on Facebook that I work with is my supervisor. So that kind of gives you an idea of how, like, cool and laid back and understanding the people that I work with now. Which actually came up in an assignment for nursing theory class. There was like a discussion board posting that we had to write about, like, we had to discuss where we're at right now in terms of role development and things like that. What are some of your achievements and concerns about the new role that you're adopting? And they only required 250 words, but in my usual fashion, I banged out about 1,000, 1,500 words on the topic. And one of the things that I touched on was the people that I'm surrounded by now, whether they're nurses or social workers or nurses' aides or any of those associated disciplines, are all role modeling very different things than the people that I worked with in the nursing home. And in the nursing home, I was just trying to get into nursing. I was a new grad and like picking up new skills and learning how to take care of families and manage expectations and actually get all the logistical, untangle all the logistical knots of how do you provide care for X number of people over 8 hours. But now my coworkers are like really involved in state and local regulatory issues about the kind of work that we're doing, and more people are involved in clinical outreach and building relationships with other healthcare providers in the community and stuff like that. So it is pretty interesting, and I'm surrounded by some really interesting people who are very patient and very educational and very understanding, and that is really so much of a better environment to be in, really, than what I was in before, where it was really just profit motivation was the chief concern in the nursing home, because they were private for profit, and everything besides profit really took a back seat, which was really frustrating to a lot of people. And now that I'm reading in this nursing theory book about like role conflict and role strain, I can look at that and say, oh yeah, that was like what working at the nursing home was like. That was it exactly. Not to say that other jobs aren't like that too. I mean, it's not always like sunshine and roses and all that stuff. There are problems that come up, but there's a greater sense that the people around me will, work constructively to find a solution that benefits everybody instead of, what's the bottom line. I have really been enjoying taking new staff members around. I think it's a lot of fun. Now that I have this brand new car, I'm less embarrassed about it, because my old car was kind of banged up and a little bit dirty, But I got this nice shiny new car, and I'm keeping it really clean this time. We'll see how long that lasts, but it's like my first new car that I bought new, So I think so far it's only been a couple of weeks, but so far I'm really taking much better care of it than any of my previous cars. I just had the heated seats put in, which are really great for my back. I was just kind of thinking about being cold in the winter, but it's 51 degrees outside right now, and I've got my heated seats on because it really is helping my back pain quite a bit. It's very nice. Sometimes I'll be hanging out somewhere and I'll think to myself, wow, maybe I should just leave and go sit in my car and turn on the heated seats so my back will feel better. I haven't recorded one of these in a while, I guess just because I've been really busy. I've been getting out at like 5, 6 o'clock a lot of times, and I forget if I mentioned this before because I haven't recorded one of these in a while, but I took a peek at my statistics about my visits. My supervisor maintains statistics about how many people we visit in a day, in a week, and stuff like that, or how long our visits are and things. And I just looked at the number of visits per day on average, because I was told that the average they're looking for is 3.8, and mine was 4.6. So I really have to like strategize more, like delegating visits to other people, so I have more time to do other stuff, like I was trying to do today. It didn't really work out. I could have gotten a lot more help with visits yesterday, but all of the people that I had coming up to see had just been seen yesterday, so it doesn't really make sense to see them 2 days in a row. You know, we gotta space it out and kind of get a feel for how they're doing week to week. So I guess that was just the way the dice fell today. But fortunately, you know, checking in with the executive assistant who pulls this whole thing together, she said that, you know, if it doesn't get done until the beginning of next week, that's okay too. I would really like to get it off of my plate. I'm only like 3 slides into it, and the presentation that I did last time, I thought it would be, you know, people were telling me to trim out slides because it looked like it was too long, but I really got through all of it in 40 out of the 60 minutes I was allotted, so I'm going to try to expand it a little bit. And the feedback that I got was kind of cryptic. One piece of feedback was that I spent too much time talking about pain and not enough time talking about other symptoms. So that's something I'll be addressing. Maybe I'll save pain for last, you know, keep them guessing if I am going to actually talk about pain or not. And then the other one was that it was not clinical enough. And I was asking people, they were probably reading this, you know, the other, you know, the clinical outreach nurse who was telling me this, who was my hero, by the way, was telling me, was probably getting that info off of like a questionnaire form or something. So when I was talking to her about it, I was like, oh, do you think I should like include some case studies? Because people seem to like case studies in my experience. People enjoy case studies. And that did not seem to be the correct answer. She said, no, it just has to be more clinical. I'm like, what does that mean exactly? So I've been pondering all of this, and every time I sit down to work at it, I just stare at the blank slide, and I'm not really sure where to go next. But you know, I'm going to try to do this by, you know, starting with symptoms other than pain and exploring those in depth. And then the other thing that my employer wants me to do is to talk about the myths associated with dehydration and malnutrition at the end of life. And this is something that I think about constantly because I talk to patients' families about it constantly when we're talking about, you know, why exactly it's not a good idea to put in a feeding tube, or why IV fluids are not really the best thing for this particular person, and things like that. So I think about it quite often, but to educate a group of nurses about this subject, and I know from prior experience some nurses feel very strongly about this in both directions, you know, or feel very strongly either way, you know, about this issue. Coming up with a good way to explain it in like a universal fashion, you know, seems to come back in my mind as like just trying to describe the pathophysiology of dying just in general, you know. And there's some good printed resources that sort of explain what kind of medical advantages there are to being dehydrated at the end of life. But selling people on this idea is not always easy. Even if there's very clear, you know, science and A&P to back it up, you know, people will say things like, well, that seems cruel to me. And communicating really like where that benefit versus burden line falls to a group of nurses, you think would be very easy because you could explain it in scientific terms. But that is not always the case because there's some deontological, moralistic, religious things going on also. Although interestingly enough, in my experience, clergy, even Catholic clergy, in the acute care setting will usually be the first ones to encourage you know, members of their religious group to concentrate on the problem of suffering, not so much extending life. You know, and kind of like broach it in terms of mercy, you know. And that's very surprising to some people who haven't encountered this, that the practitioners of the religion are the ones saying, you know, it's not a sin to disconnect the life support, you know. And it's sort of like a very limited reading of the religion that suggests that is never okay, you know. Yeah, in reality, clergy consults can be great. If you're having trouble with some certain types of things, calling clergy in to consult can really save you a lot of trouble in the long run. Oh, this is so great. The car is just totally off. Total auto stop. My car has come to a stop and it's not vibrating at all. It's beautiful. I love it. Well, it's about 3:15, and I have to make some hard decisions about how to use my time for the next 8 hours or so. But I should probably get to it, whatever I'm doing. But hope you didn't miss me too much, and I'll see you again next time I think of something to say. Alright, bye.